All right. So last thing on the blood chapter before we move on to the heart is we're going to take a look at how does the body stop you from losing blood. So this is going to really be dealing with the last of our formed elements, the platelets, and then some of the things that platelets actually go about triggering. So the whole process of stopping blood loss is what we refer to as hemostasis. Just remind yourself that homeostasis is that internal balance in the face of change in external conditions. Homeostasis is not hemostasis, even though hemostasis may help promote homeostasis. So what we're going to see is there's really three main phases to this idea of hemostasis. We're going to talk about this vascular spasm, platelet plug formation, and then go through a little bit of what happens with coagulation. A lot of this is going to be relying on platelets. So again, platelets were one of those formed elements that we talked about. They came from that megakaryocyte, that large combination of a bunch of monocytes that fuse together to become platelets. Little pieces break off, and that's what we end up with. In a normal microliter of blood, about 100 to 400,000 platelets in it. And what happens is when you get a break in a blood vessel, I always kind of say it's like if you get a break in a pipe, what's the first thing you want to do if you have a water pipe that has a break in it? First thing you want to do to that pipe is stop water from going into that pipe. So shut down the water to that pipe. Vascular spasm is a similar idea. You have a break in a blood vessel. Ideally what we want to do is constrict that blood vessel and as much as we can limit the supply of blood going through that vessel so we don't have as much leaking out of that vessel. This can last for a little bit of time. Obviously, the more vasoconstriction, the greater the vessel damage, the more vasoconstriction we should have happening. That being said, this works on certain size vessels, but if you have a large vessel, like femoral artery, brachial artery, so one of these really major arteries, you're not going to be able to stop the blood flow with vasoconstriction on these ones. That is where you get into doing a lot of times tourniquets and things like that. What's going to happen next is these platelets, and we'll talk a little bit about how this happens. Normally, the endothelial wall is coated with something called prostacyclin. This inhibits from platelets sticking and activating. What we're going to see is when they get to an actual active site of injury, collagen is exposed. The platelets, because there's not that prostacyclin there, stick to it, and they start triggering, among other things, the clotting cascades. But first off, these are all going to stick there and start almost like a bunch of stuff gumming up. It's really just going to stick together and start at least initially sealing that opening. And really as this happens, this draws in more platelets. It is actually going to increase those vascular spasms that are taking place to really try to limit blood flow to there. It starts attracting other platelets. And we're going to see this is also one of the things that is going to start triggering some of those events of coagulation. And again, this is a positive feedback thing here. It's going to keep happening, keep sticking more and more there until it's limited by starting to run into that prostacyclin in the area that's not damaged. And you can kind of see we've got to this point right here at this point where we've got this platelet plug starting to seal this. What we're going to do in the last phase here is work into this coagulation phase. So coagulation is this blood clotting. It is taking those fibrin, that fibrinogen, which we talked about being in the blood there, and converting it over to fibrin. I was going to say that along with the platelet plug is a lot like long hair getting stuck in a drain. You get enough hairs that are very fine, you cake enough of those together, it will stop water flow through a drain, as well as it will trap other things within it, much like the blood supply happens here where you start getting different blood cells that all get in there, and that is going to help seal up this opening. We're going to see that we need a number of different things to be present in order for coagulation to happen. So you need calcium, you need these different clotting factors, and we will be looking at something called the clotting cascade in just a minute. These clotting factors are proteins made or enzymes made by the liver. We need the platelets, we need vitamin K. One of the things to kind of keep in mind is the clotting factors were named based on when they were found, the order they were found. So it's not in the correct order necessarily. Clotting factor 1 was the first one that's found. It's not the first one in the chain or the cascade. And we see vitamin K is important because it is important in actually synthesizing a number of these clotting factors, as well as some of these act as proteases and can activate other clotting cascade proteins and trigger this to go down there. We're going to see there's actually two main ways that we can start this. There's one called the intrinsic pathway, another one called the extrinsic pathway. The intrinsic pathway, what it's really saying is everything needed to trigger this pathway is within the blood, within the vessel walls already. You get damage to the inside of this wall. Platelets are what are going to initiate this intrinsic pathway. It takes a little bit of time here, about 3 to 6 minutes to trigger. And I will show you a little graph showing you all this, but a little, not graph, but a little flow chart showing this. But at least with the intrinsic pathway, and I'm not going to ask you to do all these steps one by one, but platelets trigger this factor 12. Factor 12 converts an inactive form of 11 to an active form. The active form of 11 activates form 9. And then 9 binds with calcium and activates factor 3. Like it shows there. Factor 3 can then convert factor 7 into an active form, and that can meet with the rest of this clotting pathway and finish the clotting pathway. Extrinsic pathway is a little bit quicker. This is damage from the cells surrounding the blood vessel as well. You release something when these tissues are damaged called tissue thromboplastin, which is going to combine with calcium and factor 7 and meet in the same spot with that factor 10 as we saw before. From there on out, it is a common pathway from both the extrinsic and intrinsic pathways from factor 10 down. Main thing is both of these pathways can be initiated together if there's enough damage. That common pathway, though, it kind of shows you this stuff here, factor 10 along with factor 2 and factor 5, calcium, and factor 3 activates prothrombin to thrombin. Thrombin then is going to convert fibrinogen to fibrin, and this factor 13, along with the presence of calcium, will get a bunch of these fiber molecules to get in these long chains of fibers that will seal that up. And again, this is a positive feedback loop. This clotting keeps happening until it reaches this full size, and then it's limited by that prostacyclin and other stuff from it going any further. And like it says there, some of it's trapped within that clot, some of it's degraded, but it's limited by this enzyme not being active for too long. So this is the actual pathway here. What I would say on this is I would like you to know what triggers each pathway. So the intrinsic pathway is triggered by perivascular tissues and tissue thromboplastin, where the intrinsic pathway is triggered by the platelets. The other stuff I'd like you to know is the last little bit of this. So I'm not going to ask you to draw this out. I'm not going to ask you to explain the whole clotting pathway. All these factors are key. And if you're missing some of these factors, you're going to have issues with blood clotting. There is a sex-linked one, sex-linked trait that is hemophilia, which has issues with factor 10. And those people have trouble clotting. Really common in European monarchies back in the time when you had to marry other royalty. Meant there was a lot of inbreeding, and it got really common. That being said, I want you to know what triggers the extrinsic pathway, what triggers the intrinsic pathway, and then I would like you to know the bottom steps here. How prothrombin gets activated to thrombin, and it is actually this thrombin that activates the soluble fibrinogen to an insoluble fibrin, and the presence of calcium and factor 13 that gets us these fibrin polymers, which are going to lead to the finishing of this clotting. I don't need you to know every step in between, though. And again, this should generally be inactive unless there's a broken blood vessel. Every once in a while, this can also happen when blood supply slows down. So if you've ever heard of DVTs or deep vein thromboses, this happens when you're sitting for sometimes for a long period of time. You can get abnormal clotting in an unbroken blood vessel, and it's again not something that's a good thing. But again, all this leads to these mesh of fibers going across there. All these fibers trap cells, everything else in there. There's then going to be some contraction of this fibrin, which is going to squeeze some of the blood out of there, and that is what is going to lead to a sealing of a break in the blood vessel. Generally, the sympathetic nervous system and the fight or flight response can deal with a lot of this blood supply loss. Generally, 10% of blood loss or less, there shouldn't be a major response happening. If you get greater than 10%, you're going to get a lot of sympathetic reaction taking place, lots of vasoconstriction, heart rate, heart contractility are going to increase. We're going to start limiting flow to certain areas to maintain supply to the heart and the brain so everything keeps functioning. And honestly, the body's really good at this until we lose about 40% of blood. At that point, you can no longer compensate. But this is also part of the reason if you're having blood loss, stuff seems normal, and then you crash. It's mainly because the body compensates until it can't compensate, and then the issues kind of go off a cliff really fast because you've compensated to the point you can't compensate any longer. At that point, you've lost too much blood, and the body really can no longer maintain at that point. It's usually not this slow thing that you see happening all along the way. It's fine, bad. The clot is, like I said, as there's contractile proteins within this, it is going to help squeeze that and get some of the liquid out of this, makes the clot smaller. This is also involved with the breakdown of this fibrinogen, the fibrin with fibrinolysis, that is going to help get rid of this clot as things have healed. That fibrinolysis starts to begin about 2 days after the clot forms, and it's slowly going to help remove that clot or scab days after repairing the break in the blood vessel. Again, clot formation and clot elimination is a balancing act. It can either lead to bleeding or clotting disorders if it's tipped too far in one direction. Too much clotting, damaged blood vessels, strokes, heart attacks. Too little, you prevent clots and you can have bleeding disorders. Either way is kind of not something we want to have happening. When we get to these clotting disorders, there's a lot of names that go along with it. So a thrombosis is abnormal clotting in an unbroken vessel. The actual clot that forms and is attached to the wall we call a thrombus. If this clot were to break free and start moving, it is then named an embolus. So the embolus can travel through the bloodstream. If that embolus sooner or later lodges in a vessel where it gets stuck and starts blocking blood flow, that is an embolism. And embolisms can lead to infarctions, which is the cell death as a result of that embolism. Myocardial infarction, for example, would be an example of a heart attack due to a blockage of blood flow. Again, not a normal thing to have happen. It's something we want to try to prevent as much as possible. You can have too many or too few of these. Thrombocytopenia is lower than normal levels of platelets. If this starts happening, you can get small bleeds throughout the body. Some of that petechia. A lot of times this will be due to liver failure can lead to this. Just due to the fact you're not making a lot of these clotting factors. Hemophilia is also a hereditary one where you're not making you're making non-functional forms of certain clotting factors. Again, also not a good thing to have happening.